We all know that pregnancy can produce some aches and pains in the body, but what are they really telling us, and how might they be impacting birth? In today's podcast, I talk with Gabrielle Brennan, a midwife and body worker in Australia, about what the aches and pains are really telling us about our pregnant client's body. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to the Birth Healing Summit podcast. Today, I am super excited to introduce you to Gabrielle Brennan. Gabrielle is a midwife from Australia. She's also a personal trainer, body worker, and has just done an amazing job of being able to listen to the body before labor, during labor, and be able to put two and two together of what's really going on in the body. Welcome to the podcast, Gabrielle. Thanks for being here.
Thanks so much, Lynn. Thanks for inviting me back.
Yeah, so Gabrielle was a part of the summit in 2024 and did an amazing presentation on the aches and pains of the body and also baby's positioning, fetal positioning prior to going into labor. And then she's actually going to be a part of this year's Birth Healing Summit, where she's talking about troubleshooting early labor. So we've had a talk on preparing for labor, and then what can be happening in the early part of labor and how we can make effective changes there. And so what we would like to talk about today with you all is about the aches and pains that moms are having in their body and what that could really be telling us as practitioners and what moms need to know to help them have a smoother, dare I say, easier birth process itself. So, what are some of these things, Gabrielle, that we really need to help moms understand better that what's going on in their body and how this impacts their birth?
Mm. I think the easiest takeaway to really, like, if you're going to take away anything, it's not what's sore, it's that the fact that it's sore is your body saying, I need some attention, I need a little bit of help. So, regardless of what you're feeling uncomfortable in your body or where you're getting pain, if you're getting any of those messages, your body is saying, can you address me, please? Because when you get those messages in your pregnancy, your body is saying this area is under strain, it's under work, it's working hard, it's saying it can't do it anymore, it needs some help from you. It's saying don't keep doing that movement. To say, for example, for a lot of people when they're getting like some glute pain. If you're getting a little bit of that glute pain, you're going to want to start using your opposite side. That side gets tense, then you might just start avoiding sitting in a certain way, and then you might stop doing certain movements because that's aggravating it, and sleeping in different ways. So the way that you respond to your pain can really help. It's important, but it's also your body's asking for help. And so what are you going to do to help it, not just avoid aggravating it? And the takeaway of that is if your body is asking for something, do something. It's not just sending you this message for no reason. It's prompting you to help it out. And if you can help it out, you can get beautiful differences in softness. And we were saying before, a little bit off screen, we were talking about how sometimes that second trimester pain comes through and then people were like, oh, and I kind of just stopped going for walks because that was aggravating the pain, and then it just got better and it was fine. But then it comes back in the third trimester with an absolute bloody vengeance, and that's the body saying, oh, you didn't actually address me, you just avoided the aggravator. And so for a lot of people, when they avoid the aggravator, that's awesome, but the tension's still there, like the vulnerability that created that discomfort is still there, and that will often pop up in third trimester. But if it doesn't pop up as pain in third trimester, I'll still often feel the tense areas on clients, which is interesting. And baby responds to that. They respond to the tension. And then what we see, that flow-on effect in pregnancy, the flow-on effect into labor, is if babies avoid the tense areas, because that's how they navigate the pelvis. They find the most open areas to get out. So if there's tense areas, babies typically avoid it because that makes it harder for them to get out. So if there's lots of tense areas because there's been lots of pain and you haven't addressed any of that pain and all that tension's there, this baby's going to go, shit, I can't go that way. So I'm going to choose another way. And baby's
Well, you have to be
creativity
able to come
is
out.
uncomfortable. Sorry, what was that, Lynn?
I'm sorry. What did you just say there? I just interrupted you.
Oh, that baby's creativity in labor is uncomfortable. If
Say that again. Babies make what?
their creativity.
Their creativity. What do you mean by that?
Yeah. So what I mean by that is if a baby's saying, "Oh, I can't get out just being on like the right anterior. I need to actually get some more room here. I can't get out this way. I think I actually need to move to the left. Shit, I can't get to the left. The left is even worse. I think I've got to choose posterior. The sacrum's the only area that moves. Pubic bone doesn't move out of the way. I think I've got to go posterior." So that's them being creative and navigating a challenging space. And that's uncomfortable. And ask anyone who's had any kind of labor where they've been like, "Oh, my baby's stuck." It's not fun. It doesn't seem to progress as well. And if you don't need to go through it, don't go through it.
Right? So basically what you're saying is that if we have pain during our pregnancy and we avoid it and we just stop doing whatever was creating the pain and we don't address the pain, that pain can either get worse as the pregnancy goes along, or maybe it gets better, but then it comes back and
Mm.
really bites them in the butt during the labor process.
Oh yeah. Oh yeah. I when I work with mums in labor, this was a really cool one. I'm not sure if I've told this story before on here, but it was a really, really cool one. That was a great example of sciatica pain. And so this mum, first time mum, spontaneous labor, laboring beautifully, but was having like a lot of back pain, a lot of back pain. And I wasn't even the one looking after her though. I was working the postnatal ward, but the midwife who was looking after her was going, "She's got this posterior labor pattern. I can't seem to get her comfy. She's starting to crack a little bit. Can you come in and do a few things?" I was like, "Yeah, man, just look after my patients on the ward and I'll come in and help her out." So I went into this room and I just kind of watched her how she labored for a bit and she just wanted to be upright. She couldn't do anything else. She just had to be upright. And in the breaks between her contractions, I said to her, "Where are you feeling your pain?" She was like, "Oh, it's all in my back. It's just this intense pressure, like, but I don't feel low. It just feels, it's yuck in my back." And I was like, "All right, cool. What was your pregnancy pain?" She was like, "Oh, sciatica." And I asked the midwife before, I was like, "Oh, what side the baby's on?" She's like, "Oh, it's on the left." And the left is deemed like the better side, but that's like a whole other thing. I don't really agree with it, but that's like a whole other thing. I said the baby was on the left side, and I was like, "What side was your sciatica?" And she was like, "Right side sciatica." And I was like, I think there's a little something happening there. And you got this pattern that's kind of showing your baby wants to rotate. So this is really interesting. How can we help get this baby to where they want to be? And so what we ended up doing, typically I do a lot of sideline releases, but she couldn't be anywhere but upright. So I got her kneeling next to the bed to at least take some pressure out of her glutes. And I did a whole bunch of fascia work on her right glute and then a little bit of ligament work on that right glute. And as soon as those areas just softened, her sound was completely different. Her labor sound, she was making all these different noises. I was like, "Oh, where are you feeling it now?" She's like, "It's not my back, it's everywhere." And when it's everywhere, it's that baby dropping lower and the whole pelvis is feeling it. So I was like, "Stunning. I think we've done it." And she ended up going beautifully the rest of her labor. It was just the intensity of the contractions and the fullness of her baby rather than the localized sensation in her back. Because she could never lie down, I couldn't feel where her baby had moved to. But
Yeah.
just based on her sensations alone, I was like, done. And it was that right sciatica. And the tension from that, the baby was going, "I can't get to the right." Mm.
I love that. That is such a beautiful example of right sciatica during pregnancy, not addressed, influencing that labor. Wow.
Mm. It
That
was
is,
really cool. Yeah.
that's amazing. Awesome.
Mm.
So what about, let's talk a little bit about round ligament pain, okay? Because
Mm.
you know, a lot of times it's just completely blown off by everybody in the birthing world, it seems, right?
Mm.
That, we get these little twings and twangs in there. What's your take on the round ligaments and that pain in the round ligament?
Mm. So brown ligament pain, very important because
Yeah.
I actually find it links with the sacral ligament sacrospinous, and that links with psoas. So I find if I can soften those two areas, I go back to the round ligament and she's happy. She's fine. She's got no tenderness. She's completely soft without any direct work. So if the round ligament's actually getting upset, it actually speaks to two very important spots on the body because psoas does everything for engagement. It does
Yeah.
heaps for flexion. It's an incredible and very important muscle. And then your sacrospinous, I'm already thinking about where's the sacrum sitting if it's tense on one side.
Mhm.
So if there's round ligament pain, everyone does brush it off or tries to do direct releases on it. But I actually find if you soften its buddies, you hardly have to work the round ligament.
Interesting.
Yeah, that's
Interesting.
really cool.
Okay, I hadn't thought about that. So,
Mm.
why do you feel those two are connected to the round ligament? What's the what's the
Ooh,
connection?
my theory? I don't
Yes.
know.
Yeah, theory going
I
on.
just, uh, through pure exploration, I
Uh-huh.
worked out that the tenderness of it was just speaking to the uterus needing more balance. So it was trying to grip and support a lot more. And so it was typically the opposite side that had something going on. So,
Okay.
for example, if the right round ligament was given grief and on palpation, I'm like, oh yeah, that's a little bit thick, a little bit tense. When ligaments typically get more tense, it always, in my mind, comes across as, oh, it's asking for more support. So why does it need to work harder to support? It should actually be quite a soft ligament. It should
Yeah.
be difficult to actually feel, and you shouldn't really notice it. Because when
Yeah.
a ligament's saying, ah, help, it's saying, I can't stabilize.
Yeah.
So if the uterus is saying, oh, I can't stabilize that well, I need to thicken up and tense up to really hold myself there, who's it working hard for? And through pure exploration, I found that if you relax psoas, it took pressure off sacrospinous. And with those two areas softening, then the round ligament was just soft by proxy.
Are you finding a correlation between you were talking about right round ligament? Is it left psoas or right psoas that needs it?
Left.
Left.
Yeah.
Yes. The
The
body
um
loves
the support.
diagonal, doesn't it? And it needs
Yeah, it does. There's a
side.
lot of cross body
Well,
and yeah.
exactly. But
Yeah.
it makes sense if you all think about that psoas muscle is in that back part of the body. And if it's tight and tense, it may be pushing that uterus forward more on that side. Is that what you see happening with a tight
Yeah.
psoas?
It doesn't come through as easy on palpation. I'd imagine with some of the internal work you do, though, it's probably easier to feel because you'll feel that compensation uterosacral. But
Mhm.
I haven't found that there's been an obvious rotation in baby. It doesn't seem to come through as easy on an external palpation.
Okay. All right.
Have you
Interesting.
felt different?
I haven't put two and two together with the round ligaments. I directly treat the round ligaments and
Mm,
I've been looking more like since we talked last time, the stacking of the fundus on top of the baby's head. And I
mm,
find that when fundus is side bent or torqued, that round ligament is usually tight, pulling it over and releasing that. Then I get, better positioning of babe there. But I
mm.
haven't addressed or really looked at the correlation with psoas and the sacrotuberous, sacrospinous. What
Sacrospinous, yeah.
you find what is your big differentiation between sacrotuberous and sacrospinous? Do you find a differentiation between those two, or do you find both
Mm.
of them together? And what's the differentiation if there is one?
I find, well, sacrospinous, she's sharp. She's got a tongue on her. She's an uncomfortable one to release. Sacrotuberous, the dull, achy. I find there's different positions with babies that I'll see with tension in either one. So I'll find lots of different positions for tension in different areas, but also the buddies that help them relax are different as well. So they're quite different. I find I'm gravitate a lot more towards sacrotuberous rather than sacrospinous. I think she's got a much bigger role,
Mhm.
and even in the birth space, the releases I'll gravitate towards will be a lot more about sacrotuberous and sacrospinous.
Yeah. I find sacrotuberous and coccygeus muscles internally are
Oh
very
yeah,
much connected, kind of like an Oreo cookie. If you're going to treat
yeah,
one, you got to treat the other, like inside outside kind of connection there. So, um,
totally.
yeah,
Oh,
and
I
that,
love that. Yeah. Because the internal perspective is super different when it comes to like how it all feels. And you've obviously been in that practice for so much longer than I have. So I find it so fascinating when I combined the external and the internal work, how they connected and how there was a lot of opposites to what I felt externally. I thought that was really interesting.
Yeah. Yeah, yeah. And to me, tension in the pelvic floor muscles is a repellent towards baby's head. You
Oh
know,
yeah.
baby avoids that tension in the muscle. And so if right side is tight, baby's head is off to the left. And when we have bilateral tension, we have a high floating head. Baby doesn't want to engage,
You
right?
nailed it. Are you a midwife?
No, in fact, I've never been throughout an entire birth. I would love to kind of do that more, but I
Yeah.
used to work next to the birth center, and they would call me in when a couple of people were, I was called in a couple of times for moms, and I was able to make some good changes, but baby didn't stay. So
Mm,
we made change and then it went back and they ended up having to transfer. So that was unfortunate. But yeah, it's
mm,
I just find it so fascinating and so fun. And I think that there's so much more for all of us to learn in this space when it comes to this space. And I absolutely adore talking with you, Gabrielle, because I cherish your perspective in being a midwife and coming at it from your perspective, but also having the body work. It's such a
mm.
beautiful, I truly believe like all midwives should be body workers. What
Yeah, that should be our practice. That should be what a midwife's role is.
Yeah, and I
Mm,
think it would just I think if more OBGYNs could have more skills in doing release work in the bodies and understanding that, I think it would be
mm,
that alone could really change our birth outcomes here
mm.
completely.
I think the understanding is probably the best we'll get because their practice is so busy and so high acuity, they just wouldn't have the time to sit down for an hour with a patient and do release work. And it's a sad reality of their job.
Well, I know in your summit interview, you were talking about your midwives, you guys go into this practice thinking that you're going to be with women, but actually you're with
Mm.
paperwork during the
Yeah.
birth process. And that's not why you became a midwife, was to do
Mm.
paperwork. But
No.
it really is that, the ability to hold hands. And I think that's, again, another important reason why we need more doulas and doulas to be at these births. But yet, what you and I both know so importantly is that it's the body work, it's the soft tissue release work that we can do with our pregnant clients and even laboring clients to make
Mm.
the changes like that example you just shared with us and being able to open up that space for baby to go where it wanted to go is so critical in allowing the babies to be able to be born vaginally.
Yeah, absolutely nailed it. It's working with them, not telling them where to go. It's giving them all the options. I often describe it like if baby only had A, B, and C to work with, and they're just going to choose the best out of A, B, and C, we're coming in and giving them A, B, C, D, E, F, and G. So we're giving them so many more options. And they still might say C is the best, or they might go, oh my God, like E is so much better. I think I want E. But they were happy to make C work until we gave them something better. And better just equates to all of these beautiful outcomes in labor. Like if we give baby a better and easier position to navigate, you often have mums having not as long of a labor. And I see that a lot because you give a baby room, they take it like that, and they do something completely different with the contractions, the descent. I've seen babies just pop out like 10 minutes after work. It's insane how quick a baby will take the space when you give it to them.
Yeah.
I've seen comfort improve. I've seen that pain that a lot of people get in their bones in the labor, that awful, like crushing kind of feeling completely disappear when you give a baby room. It's just, you could go on and on and on.
Yeah, so we started off talking about the aches and pains of,
Mm,
a pregnant client. So how can we as practitioners, and I don't know if you have the answer to this, but how can we help moms understand our pregnant clients? How can we help them understand the importance that these aches and pains are trying to give them information to help support
mm.
them to have smoother births?
I think it really links in if you've got that capacity to do abdominal palpations and feel baby position. Because for a lot of my clients, they can really see the impact of their pain and their tension in baby's position. So, for example, someone might come in with some pubic bone pain and they've had it for 10 weeks and they've done lots of different things for it, but more about avoidance rather than like getting it comfy. So they've just tried to avoid their triggers, which is what a lot of people do, and that's awesome, but haven't done anything to actually address why the pain started in the first place. And then I'll feel their baby and go, oh, that head's a little bit off to the center, like off center. So it's tilting a little bit. And you can see how baby's avoiding the tension because of the pain. And so when you can draw those links together for mums, they go, oh my God, what does that mean for labor? And I would say, typically, if I've seen this position in labor, it creates a very long early labor. And that long early labor often invites a lot more intervention. And then we all know what intervention brings. And a great example of that was I love telling this story. It's one of my favorite ones. It was a mum's third, I want to say third or fourth baby. I think it was her fourth baby. And all of her labors prior, she would have one contraction and then just continue progressing and just go all the way and birth a baby. Normally within a couple of hours, just efficient, got it done. Baby number four, though, she was on day 3 of early labor and was like, what the hell is happening here?
Ah,
Reached out to me. She was like, this is very abnormal for my body. I would have birthed my baby 3 days ago. What the hell is happening? I got her in for a session, little off center head. Now, for her pregnancy pain, she had like a few pains here and there, and it was correlated with exactly where baby was avoiding. So, as you were saying before, tension on the right, baby's going to the left. They avoid the tension. And so, with that little off center head, she was still contracting in the sessions as well. But fourth time mum, if it's not 10 out of 10, she's like, meh, whatever. So, she was just a trooper, just accepting the work, still contracting, hardly breathing through it. You'd never know. And her partner was there, and so were other kids. So there was a lot happening in the room. And as soon as we kind of did the work, felt baby, they were beautifully centered. And she stood up off the table afterwards, and her face just dropped. And I was like, "Oh, are you okay? Like, do you have pain? Are you all right?" And she's like, "This is what it feels like when my babies are about to come out." And I was like, oh, off you go to the hospital. Off you go. She's like, oh, got to drop the kids at home. Got to go to the hospital. And she ended up birthing within 4 hours. It was like 3, 4 hours of the session itself. So she
and
just
what,
got it done.
yeah, what did you find in her body?
It was, oh, yeah. So I think this was a year ago.
Yeah, yeah.
But I remember reading her notes recently when I told the story to someone else. I think I actually saw her sister in the clinic as well. We were just rehashing that beautiful moment. But I think it was something along the lines of her baby was avoiding the left side. So the head was going towards the right, which is much more common. I normally see babies head more into the right side compared to the left. And so we did a lot of left-sided work. And I can't remember what her aches were. I couldn't tell you, but I remember thinking like, oh, that makes sense.
Yeah.
And so when we did a lot of that left-sided work, baby straightened up.
Yeah. I, so what pops into my head as you're telling that story is I wonder if she carries her baby a lot on that left side. So she's raised 3 babies. And as moms, we get into habits. So if she's right-handed, she's carrying that baby on that left side, standing with her hip out, holding babies on her hip. If 3 plus years of doing that created this imbalance that caused baby to go to the right.
Totally. It's always something that's a more habitual,
Yes.
like sitting at a computer and leaning with your arm. That's a really big one. That right side just gets so locked up from it.
Yeah. Driving.
Mm. Driving's huge.
Yeah.
Standing, people who have standing and repetitive, like moving jobs. Normally, it's anything that you're doing a lot of the time that makes you uncomfortable. That's going to be your pregnancy pain, which is why working on pain prior to pregnancy is very important.
Prior to labor, working on pain in pregnancy prior to labor, correct?
Yes, but also pre-pregnancy.
Amen.
Yeah, yeah.
Amen. Yes.
Yeah.
Yes.
Because
Totally
so
agree.
many people say, oh, I've had back pain for 5 years, or I always have sciatica on and off. It only pops up every couple of years. And I'm like, mate, that's going to come out in your pregnancy
Yep.
in one way or another. Work on it now.
Yeah. Yeah. So
Yeah.
important. Is there anything
Mm.
else? So what I'm envisioning from this, Gabrielle, is that, I look back on, I've been working in the postpartum space since 2009 now. And when I started back then, there was hardly anything on the internet. And now there's just so much great information on social media about postpartum recovery. And
Mm.
I don't believe we're there yet. And I'm hoping that we can get there, that the information about pain in pregnancy is so important to address prior to going into labor,
Mm.
and the impact that that pain, if we don't address that pain in the pregnancy, how that might impact our labor. I'm really hoping that this conversation, your interviews during the summit, will explode the social media posts to help educate moms more in understanding, because their OBGYNs are just blowing it off and saying, yeah, you're pregnant, so pain is, part of being pregnant. But the message that really needs to be getting out there is that pain is a sign of dysfunction, and that dysfunction may impact your labor.
100%, like word for word. There's a lot of dismissing out there. We shouldn't be dismissing anyone's pain. Pain is an important and intentional message. Your body's asking for help. Don't just try and avoid pain. Try and work out why your body's cueing pain. And sometimes it just takes finding the right provider to help you through it. Sometimes you can troubleshoot it yourself. But I always find messages in my head of my body's pain gets confused with what I know. And I'm like, my body's cueing here, but I know it's not there, but I don't know where it is. So
Right?
having that external person helps a lot.
Absolutely. Absolutely. So I just
Mm-hmm.
hope, whether you're a mom, whether you're a practitioner listening into this episode, I really hope that you can help us in getting this message out to pregnant clients that their pain is important. It's a message from their body telling them that it needs support. And
Mm-hmm.
that, we are the practitioners that can help them in supporting their bodies to
Mm-hmm.
get rid of the pain, but also to help them have a better, smoother birth as well.
Yeah, well, that's a beautiful flow-on effect in pregnancy. It's not just comfort. It's if you reduce all those tense areas, it makes it much easier for your baby, which makes it easier for you. So, like, where's the con?
Right.
There's
Well,
there's no con.
the con is spending money on themselves, taking the time,
Oh, yeah.
right?
I think, yeah,
That
we
is
should
what,
always invest in ourselves. That's
amen.
where I put all my money.
Amen. Amen.
Yeah.
I hear you. Yeah,
Mm.
because we only have one body. We need to take care of
Oh,
it
yeah.
every. And
Oh, yeah.
our body's constantly talking to us. Like my dry mouth right now is wanting water. So we need to listen to those
Yes.
signs and signals from our body and know that it's just a way for our body to say, "Hey, I need something. Listen to
Hmm.
listen to me." So I think we're fighting the lack of interoception in our body, the lack of being able to read our signals, to listen to what our signals are telling us, because I there is a lot of gaslighting in medicine these days, and OBs and people telling moms, "Oh, well, you're in pain, yeah, you're pregnant, just accept it." And
Mm.
that's not the message we want to get across here. And we've also might not be listening to our bodies like we should be. And so it's not listening to our bodies, and it's not investing in our own health and well-being. And so I really, we got to do the best we can to help educate moms, help them to find the right support that they need to be able to have babies without all the pain and discomfort, and babes can come out smoothly and easily, avoid those C-sections,
Hmm.
and it's so possible. So thank you. Any last wisdom you want to share with us?
Oh, there's so much. I would say your body's comfort is just the biggest clue to anything and everything. And it's something that you should just take throughout your whole life. If there's discomfort, investigate why. You can take it into your labor. It's so powerful. If you're uncomfy in a position, there's a reason. So find another position. If you're more comfy, it means there's more room. So there's only beautiful things that come from listening to your comfort. And it's a body comfort, not a brain comfort, because they will feel like different things.
Tell me more about that. What do you mean? What's the difference between brain comfort? Is that the chocolate ice
Oh,
cream that I want to eat?
I was gonna say I can only relate it to food. So my body will send me the message, you're hungry, you want to eat. And my brain will go, I need food really fast because I just need that sugar hit. I really just want that carb right now. My body's like, no, you want sustenance, you want protein. And I'll go, KFC. My body's like, no, no, there's a lot of oil and that's not really great for me. But my brain will be like, that's what you want, KFC. So it's misinterpretation or kind of like an interesting interpretation of the message. I think that's something that we all just have to work on. And now I'm at a stage with my body, I'll be like, oh, I'm craving chocolate. Oh, I think I really need like some fruit. I think I'll have some fruit because that will just hit like all those beautiful little electrolytes that are like that magnesium and like all of that. Like, oh, that's what I'm craving. Like my body's craving that, but my brain goes, must be chocolate. Yeah. So I
Love
don't
it.
personally know how it yet relates to labor, having not been through it myself.
Yeah.
But I feel like in labor, the message is so loud from the body that your brain's just drowned out. You go into labor lane, you're just doing stuff. And I think it's intentional that way because the body knows it all and the brain is just guessing.
Oh, I love it.
Mm.
I love it. And that's why, as practitioners, we need to learn to listen to the body. And what I like to teach is let's get out of our head and into our hands as we're working with our
Mm.
bodies.
Oh
Bodies are,
yeah, very important.
yeah. So our hands can sense and feel way more than what our brains can tell us is going on. Yeah.
Yep. Yep. Put the
Awesome.
brain aside, let the body tell you.
Good.
Very powerful. Changes.
Yeah.
Exactly right.
Yeah. So,
Yeah.
Gabrielle, tell us a little bit more about what you're covering on this year's Birth Healing in Summit.
So I'm going to be talking about troubleshooting early labor because that's another really beautiful space, but also sad because it's very hardly acknowledged by many providers because it's just deemed as this fluffy stuff that happens before the really good stuff happens. But early labor is actually when all the important stuff happens. So the active labor can just be, okay, strong contractions, get the baby out. The early labor is the prep work. So if we nail the prep work, we do much better in the main event. And this is why I think troubleshooting early labor is important. It's like that second message from your body. Your pregnancy is sending you pain signals saying, get these soft, make sure they're soft and comfy for birth. And then in labor, you can get different pain signals or different contraction patterns that will be cueing different areas to work on. It's another cue. It's a second cue. Can you work on me now? Can you listen to this now? Can you make this easier for us later on? Because your body and your baby don't know that cesareans and forceps and oxytocin hormones are a thing. It's
Yeah.
got no idea about that. It's just thinking if we don't get this baby out really effectively, everyone's at risk. And so you have to think about it in that perspective. My body's going to be doing so much prep work to make this as safe as possible without any of modern medicine, because that's what our bodies know. Our bodies only know us. Our brains know a lot of other things. So I'm
I
going to be talking a lot more about that.
Awesome. And I love I think we talked about this in the interview and that, the body gives us a little signal and then a bigger signal and then it gets out a bat and then it gets out a 2x4 and then so don't listen to it, everybody. By the time we get into labor, it's all it gives you way much stronger signals. So let's listen to it early on and adjust things. So yeah, it's an awesome interview, everybody. I'm excited to share it with you. Gabrielle has a great PowerPoint that she shares, and she's got an awesome handout that is going to be so helpful for you in your clinical practice. So please make sure you join in and listen to her interview and grab her free gift that she is offering because it's worth the attendance to the summit just to listen to what Gabrielle has to share. So thank you. You are amazing. I am so grateful to you for the work that you're doing and sharing with everybody out in the world. It's so needed. It's so important. And I'm so honored to have you be a part of this and be on this podcast and just sharing your wisdom with us. Thank you.
Amazing. Thanks so much for having me back, Lynn. Such kind words as well. Really
Oh,
excited for everyone to watch the interview. And yeah, I look forward to watching all the other stuff that you're going to have on there too.
yeah, there's some good ones so far. So, and I
Mm.
love how they all kind of intertwine. So we're going to have breech birth. We have some OBGYNs talking about how to support hospital labor. We've just, yeah, they're really, really good, and they tend to overlap a lot. So it's beautiful to get different perspectives on things. So, um,
Beautiful.
yeah, check it out, everybody. Please check it on out. Join us for this year's Birth Healing Summit in April, and I'm excited to share it all with you. So thank you, everybody, for listening to this episode. Here is to smoother births and faster recoveries, and we'll see y'all on the next episode. Take care, everybody. Bye-bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.